Okay, so good day, everyone. I am Dr. Rentor Cafino, the director of our Makerspace here in Zamboanga City Medical Center. And before I start, a few disclaimers. I am still a resident training under the Department of Ears, Nose, Throat, Head and Neck Surgery. I am not an expert in 3D printing by any means. I am merely a maker who just happens to be a doctor. My slides contain some graphic images. So that being said, allow me to proceed with my talk entitled The Practical Applications of 3D Printing in Otorhinolaryngology-Head and Neck Surgery. Let me introduce my team just a bit. We are a small makerspace run by yours truly and two others, Dr. Sullivan and Dr. Cortez. We are under our mother hospital, Zamboanga City Medical Center, and we work very closely with FAB LAB Mindanao. 3D printing, since its conception, has been associated closely with medicine. It has been used for the creation of 3D printed templates, the fabrication of prostheses, surgical cutting guides, drill guides, and even implantable devices such as the heart valve, an ear, which was discussed earlier, and the bladder. In the field of otorhinolaryngology, conditions such as facial fractures and tumors of the head and neck are greatly debilitating and deforming. So piecing together these fractured segments and reconstructing the defects left behind by tumor resection usually involve titanium implants. These implants have to be contoured according to the patient's anatomy. The spatial intelligence needed to perform this accurately takes years and a lot of experience to master. 3D printing can help in this field as it provides the surgeon with a physical model of the patient's anatomical part. This will allow the surgeon to pre-bend the plate and contour it accordingly prior to surgery. This not only improves the fit of the implant, but also reduces the time needed to adjust the implant intraoperatively, eventually leading to a shorter surgical time. So allow me to present a case that we performed about last year. This is a 46-year-old male with a 4-year history of a slow-growing mandibular mass. This patient had a multicystic ameloblastoma of the mandible, which necessitated surgical removal. We reconstructed the patient's mandible by extracting the file from his CT scan and creating a 3D model. The 3D model underwent virtual surgery, which we then printed out and used to pre-bend our implant. Here's the defect left behind after the surgical removal. And here's the surgical specimen measuring 10 by 11 by 9 centimeters. We then installed the pre-bent mandibular plate. And here is our patient before and after. Notice that we were able to preserve the patient's mandibular contour and the patient's function. This patient is actually still to undergo a second stage procedure, which is the reconstruction of the mandible using a free fibular bone graft. However, due to the COVID pandemic, has been delayed. Here's another case that we used surgical planning to 3D printing to help in our surgical planning. This is a 9-year-old female with a 2-month history of a rapidly enlarging oral cavity mass. This patient's biopsy revealed an aggressive central giant cell granuloma of the mandible. The decision as to whether remove a segment of the patient's mandible or just remove the tumor and leave a bit of normal bone was greatly aided by 3D printing. So we reconstructed the patient's mandible by extracting it once again from the patient's CT scan. Here we can see the 3D printed model that we have, and we measured out manually the parts that we expected to remain after the surgery. The consensus of the team was there was enough normal bone to maintain the integrity, the structural integrity of the mandible after removal of the tumor, which led to our decision to just perform a surgical excision with peripheral ostectomy for this patient. This patient is still to undergo surgery in the following weeks. Another application for 3D printing in our field is the creation of anatomical models for surgical simulation. As you can see here are a few models of temporal bones which we use to practice our mastectomies on. So how do we do it? CT scans contain a large amount of information where we could get our 3D models from. We usually extract it in a program called 3D Slicer. So as we can see here, we highlight the area which we want to turn into a 3D model. As we can see here highlighted in yellow, this is a temporal bone model. It can be done via automatic segmentation or manual segmentation. Not much of a difference is clear, but if you put them side to side, we can notice that the automatic segmentation has more holes than the manual segmentation. This means that the computer automatically decides areas that it thinks is bone. However, it leads to certain inaccuracies, whereas manual segmentation relies also on the knowledge of the person doing the editing or the segmentation. After extracting the file from the CT scan, we import this 3D model to another program called Mesh Mixer. Here we can do what we call virtual surgery. Here is a mandible that has already been extracted from the CT scan. As we can see, there is a tumor on the right side of the mandible. It is necessary to remove this tumor and recreate the opposite side of the mandible in order for the model to be used as a template. This is how it is done. We bring the file over to Mesh Mixer, and then we cut the mandible at the middle and reconstruct the other side of the mandible by means of a function called mirroring. As we can see here, the missing part of the mandible has been reconstructed by copying or mirroring the normal side. However, care must be taken to ensure that the joint is in its correct position. Here is the model pre-reconstruction and post-reconstruction. This model can then be 3D printed and used as a template to prevent the mandibular recon implant. Recently, we have been adapting 3D printing for simpler applications, such as the creation of nasal splints. For those who are familiar with 3D printing, we use the inherent property of a plastic called polylactic acid. For those who know, polylactic acid has a very low melting point. When printed in thin sheets and perforations like this, we can dip them in hot water and contour them accordingly to act as nasal splints. This is a cheap alternative to an already existing nasal splint that is made out of thermoplastic, which costs about 300 plus for one small piece, while this one costs about 100 or less. So the department has not only used 3D printing in surgical applications, but we have also used 3D printing in practical applications, such as creation of certain things to help mitigate the transmission of COVID-19 during this said pandemic. So the department joined makers around the world in creating and distributing 3D printed face shields to help mitigate the lack of PPEs during this time, during the first part of the pandemic. These designs were made possible through collaborative efforts of makers worldwide rather, and we distributed more than 400 face shields among our health workers in and outside Zamboanga City. We also created a modified negative pressure booth, which was inspired by the South Korean swabbing booths. However, we were met with the difficulty of obtaining materials, which led to the makerspace having to step in and create 3D printed fixtures for the said booth. This booth was termed a safe box, and it allowed us to perform aerosol generating procedures such as otoscopy, laryngoscopy, and nasopharyngeal swab despite the pandemic. Another is the creation of the Biofluid Guard, or an endoscope shield, which offered an extra layer of droplet protection during endoscopic procedures, such as laryngoscopy and nasal endoscopy. We also printed out video laryngoscopes that were inspired by Air Angel. These laryngoscopes were then distributed to our anesthesiology department, and here is one of the endoscopes in action. We also help out our friends at the ophthalmology department by creating breath guards for their slit lamp, which consisted of 3D printed C-clamps, and plastic pipes, and clear plastic wrap. These efforts were recognized in a journal article published by La Peña et al. During the first part of the pandemic. We also recently published a paper on a modified method of face-to-face consultation during the COVID pandemic using USB cameras, which we termed ONVEX, or on-site virtual examination. So this is the setup where the physician is separated by 1 meter distance from the patient, and the patient uses the USB cameras with a 3D printed fixture to examine areas that the physician wants to examine. So we can examine the ears, the nose, and the oral cavity using this method. Here are a few pictures we were able to take during this examination. As everyone knows, there has been a recent spike once again in COVID cases, which necessitated us to shut down our face-to-face consultation to limit the amount of patients coming in and out of the hospital. So we have to turn to purely teleconsultation to see our patients. However, as everyone knows, this is very difficult for us to assess our patients using purely teleconsultation. Hence, we modified our ONVEX into a thing we called OFVEX, or offsite virtual examination. We created an ergonomic 3D printed handle for the USB camera with a slot for a speculum and for a tongue depressor. This allowed us to use one endoscope to examine the ears, the nose, and the throat. Here is what our online consultation kit instruction manual looks like. And here is one of my residents checking a patient for during an online consult session, where she's instructing the patient on how to use the said OFVEX materials. The maker community has joined hands with the health community in mitigating the spread of COVID-19, and it has extended beyond that. We have started training physicians, especially otorhinolaryngologists, in 3D printing. Here is a session of FAB Health where we taught our otorhinolaryngologists how to extract files from our DICOM images and to print it out in 3D printers. So we can see here our doctors have printed their own mandibles, which they have created from scratch. As Bob Ross said, we have no limits to our world. We are only limited by our imagination. This is a call to our participants, especially our doctors. Please join the maker community and make your ideas come to life. These are my references. And muchísimas gracias.
Thank you so much, Dr. Cafino, for that wonderful slides that you've shared. I've seen the same case file so many times, and yet I'm always in awe of the how 3D printing can help. For example, the jaw operation. I'm gonna ask the same question that I asked with Dr. Mukzi. As you know, Dr. Cafino, you're only a doctor and the maker combined. There's only literally a handful of them in the Philippines, such as you, no? And most, if not all, of the doctors, although familiar with 3D printing, aren't really interested in venturing into this path. So, do you have any advice for our doctors who will be just starting their experience with 3D printing?
Thank you, Sir Kim. Sir Kim, you've been with me from the start of all of this. I think you're used to the presentation so much na, no? Okay, I hope the doctors who are in attendance would want to get into this field. It's hard only at first. It'll take a few tries, maybe a few hairs off your head, but the ultimate goal and reward here is actually your first 3D print when you start seeing layer after layer come into into a reality. It's something that would make you say, what a time to be alive. As a friend said, we're barely scratching the surface of 3D printing, but we can never progress if we don't start. So my advice is get yourself a cheap 3D printer, preferably one that needs the least amount of manipulation or the least amount of processing for you to be able to use. I think a Prusa would be a nice place to start, although it's a little bit on the costly side. But the next thing would be connect to your closest Fab Lab. They can help you in technical matters, and if you need a print job done, they'll be there to do it. Thank you to Sir Archie for being there to help me with my printing needs. So that's all, Sir Kim. Thank you.
Okay, thank you for that, Dr. Cafino. So what I picked up from that, and I agree with it, is that for the doctors, I also agree that it's really it's a certain feeling you would feel if you have print your first own item. No, and the way to do that is to there are cheap 3D printers out there, very, very cheap and affordable. So you can start with those printers. There are lots of materials available online. And also, while being situated in the universities, there are a lot of Fab Labs in the country, and they sure do hope one is near with you, to the participants, to the doctors, and you can always reach out to these Fab Labs for collaboration, especially on the 3D modeling side or on the 3D printing side, if you have any questions.